In this video we are going to demonstrate measurement of JVP. As you see in this case, we will go by some steps. Step 1 is make the patient 45-degree angle. Neck should be relaxed and the head should be slightly turned to the left side. And here you can see the landmarks. That is, you can see the pulsations of the external jugular vein. This is the external jugular vein pulsations as it is crossing the sternocleidomastoid muscle going towards the angle of mandible. And here it is you can see the pulsations of the internal jugular vein. You can see here the pulsations of internal jugular vein. This is external jugular vein. This is the internal jugular vein pulsations. And if you see the internal jugular vein pulsations, upper limit is this. This is the upper mark. So step 1 over. Now step 2, we have identified the external jugular, internal jugular. Sometimes internal jugular venous pulsations are very difficult to visualize because they are deep seated in facial planes. Sometimes but the external jugular vein pulsations are easily seen. In those circumstances, you can go for external jugular vein pulsations, as there was an earlier video in the clinical snippet. In this case, we are able to identify the internal jugular vein pulsations here. So if you see, this is the upper limit of internal jugular vein pulsations. So step 3 we have to start identifying the angle of Louis, sternal angle. This is a sternal angle. Keep the scale here, and you have already identified the internal jugular vein pulsations. Again. So this is the upper limit of internal jugular vein pulsations, and making the second scale should be parallel to the ground. This is the measurement. So this is around 3.5 centimeter. If we add 5 to 3.5 centimeter, it becomes 8.5 centimeter. So JVP is raised. This is how we measure the JVP.